Today now we study in Pharmacology, B.Pharm 5th semester. So, are you guys ready for the video? So today's topic is Pharmacology of drugs acting on cardiovascular system. In this video, we will understand the first topic of Unit 1. That is Introduction to Hemodynamic and Electrophysiology of Heart. Let's start. The heart is a muscular organ that works like a pump and continuously circulates blood throughout the body. The human heart consists of 4 chambers: right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart carries deoxygenated blood to the lungs, while the left side pumps oxygenated blood to the entire body. Now let's understand hemodynamics. Hemodynamics is the study of blood flow and the forces involved in circulation. The cardiac cycle consists of 2 main phases: systole and diastole. Systole means contraction of the heart, while diastole means relaxation of the heart. A normal heart rate is about 60 to 100 beats per minute. Now let's understand cardiac output. Cardiac output means the amount of blood pumped by the heart in 1 minute. The formula is cardiac output equals heart rate multiplied by stroke volume. Normal cardiac output is approximately 4 to 6 liters per minute. Cardiac output is affected by 4 factors: preload, afterload, contractility, and heart rate. Now let's move to electrophysiology of the heart. Electrophysiology deals with the generation and conduction of electrical impulses in the heart. The heart has a specialized conduction system. The impulse starts from the SA node, which is known as the natural pacemaker of the heart. From the SA node, the impulse travels to the AV node. Then it passes through the bundle of His. After that, it spreads through the right and left bundle branches. Finally, it reaches the Purkinje fibers and stimulates ventricular contraction. Now let's understand cardiac action potential. There are 5 phases. Phase 0 is rapid depolarization due to sodium ion influx. Phase 1 is initial repolarization. Phase 2 is the plateau phase due to calcium ion entry. Phase 3 is repolarization due to potassium ion exit. Phase 4 is the resting membrane potential. Next is ECG. ECG records the electrical activity of the heart. P wave represents atrial depolarization. QRS complex represents ventricular depolarization. T wave represents ventricular repolarization. So in summary, hemodynamics explains how the heart pumps blood. Electrophysiology explains how electrical impulses are generated and conducted. Both are important for maintaining normal cardiac function and understanding cardiovascular drugs. Thank you. In the next video, we will continue with the next topic of Unit 1.